The World Health Organization has officially recognized Noma as more than a disease, but a social marker of extreme poverty and malnutrition, affecting the most vulnerable populations. WHO Director General Dr. Tedros Ghebreyesus, who said this, explained that Noma affects malnourished children and is mainly observed in areas like sub-Saharan Africa, with some cases in the Americas and Asia. Multiple risk factors associated with the disease include poor oral hygiene, malnutrition, weakened immune system, infections, and extreme poverty. It was explained that Noma is not contagious, but tends to strike when the body's defenses are down. Treatment involves antibiotics, advice and support on practices to improve oral hygiene with disinfectant mouthwash, that's salt and water, or chlorodyne can be used, and also nutritional supplements. Now, Dr. Ifeanyi M. Nsofo, a global health equity advocate, joins me to unpack this recent development. Thank you so much for your time.
Thank you, Dabo. Thank you for having me.
Can you describe the prevalence and impact of Noma within the Nigerian context, and, of course, its association with extreme poverty and malnutrition?
Okay, so essentially is what you've described. In Nigeria, it's predominantly in the northern part of the country. Again, because of extreme poverty. But as far as I'm concerned, it's really more of a failure of our primary healthcare system within context in northern Nigeria. In this case, being specific to the country, where you have lots of poverty and people don't have access to healthcare. Starts at a wound in the mouth, in the gums, not treated. And when you talk about wound healing, one of the principles is to ensure that the wound is dry. If a wound is dry, it's more likely going to heal faster. But if you have a wound in the gum of your mouth, the likelihood of it healing quickly without proper treatment is very, very low. And when you now throw in malnutrition, which weakens your immunity again, what you have is a recipe for disaster. The wound festers, and before you know it, it just eats up the tissues and eventually the skin, and in very extreme cases, even other organs in the face, the eyes, parts of the nose, the jaw, and everything. So it's really serious, but it's a disease of inequity, a disease of poverty, but to me, most importantly, a failure of our primary healthcare system.
Now, what are the primary risk factors contributing to the prevalence of Noma, particularly in Nigeria, and how can socio-economic factors intersect with health outcomes concerning Noma in Nigerian communities?
So you see, there's something the WHO says about primary healthcare. The WHO says that 80 to 90% of the healthcare needs of an individual can be provided at the primary healthcare level. So what it means is that if there's a functional primary healthcare system in Nigeria, in most of those communities, if a child age 5 and below, for instance, has a wound in the mouth, the first thing they should do is to visit the primary healthcare center, or at least visit a community health extension worker that would look at the mouth and say, okay, you need to go and see a doctor or see a nurse or see somebody, a better qualified healthcare worker that can provide the kind of treatment that they require. But what you have is, we don't have this, our primary healthcare system is non-functional. So when people have such wounds, what they will usually do for kids is to look for alternative means. They may go to a native doctor, they may take, native concussions, and before you know it, it just worsens the system for the child. And that's why for me, that primarily the issue here is we don't have a functional primary healthcare system. And when you throw in insecurity in some parts of the north, for instance, you would understand why you may not have, even if you have a health center, health workers may not be there, because of insecurity. Health workers are not able to come. The ones that have been there have faced all sorts of issues in the past. So it's a mixture of dysfunctional health system, unavailability of primary healthcare system, poverty, lack of social determinants of health. Things like, ensuring proper nutrition, ensuring hygiene, education for the child. And there are just several issues that come into play here. But ultimately, we have a situation where a child who ordinarily would have, a wound in the mouth, that a primary healthcare center can address easily, those such wounds are allowed to fester, and we have Noma. And what WHO has done by recognizing it as a neglected tropical disease, well, it's welcome, but it's just something that has been long in coming, because within neglected tropical diseases, Noma itself is neglected because initially it was not even identified as one.
Okay.
But this recognition really would draw resources and hopefully more action towards ensuring that no child suffers such disease and eventual disfigurement of the face.
All right, I would love you to elaborate on the strategies or interventions implemented to address Noma cases in Nigeria, if at all any.
Oh, I mean, there are different interventions. The first is, let's have a functional primary healthcare system. So if you look at places that have functional primary healthcare system, you will see that incidence of such issues really drop significantly. But we have thousands of children, and even adults now that suffered Nomas as children, having all sorts of facial disfigurement. And there's a national Noma center, the National Hospital Abuja. Recently, Nigeria Health Watch did a very beautiful article on that. What they do is that they provide surgical repairs, because when you see very extreme cases of Noma, essentially half of the person's face is gone. So it requires proper surgical intervention to ensure at least a reasonable amount of repair is done for that person. But ultimately, is to ensure that families are properly educated, about proper nutrition, breastfeeding for the child, using locally available foods to prepare nutritious meals, ensuring their environments are clean, hygiene, providing access to clean water. These are the different interventions that are available. But ultimately, even if you look at these different interventions I've mentioned, they are all part of a functional primary healthcare system. And this is why it is really very important that governments across Nigeria must take responsibility. This is not something we have to keep depending on donors for.
All right.
Just make our primary healthcare system work, and we'll deal with such issues.
Now, let's of course, look at this issue from a very basic level. How crucial is community engagement in combating this particular ailment? And what approaches have proven successful in, number one, raising awareness and also promoting preventive practices?
Oh, community engagement is key, because everything really starts from having the right knowledge. And I like what the University of Global Health Equity in Rwanda says. To achieve equity in healthcare, you must achieve equity in health education. So, engaging with community members, community leaders, thought leaders within different communities on the right things to do, really, really very important, to doing the right thing. Because, once a family knows that, look, this wound this child has can actually progress to something much more severe, even if they don't have a functional primary healthcare system, they will be compelled, to take the child maybe to the next community or to the next local government, or leave their village to the town before it gets out of hand. And I think one of the saddest things about Noma is that it's such an entirely preventable illness, a totally preventable illness. But unfortunately, because of poor knowledge, but ultimately, lack of the political will and action of different governments. I need us to focus on local governments here, because primary healthcare in Nigeria is within the purview of local government councils. So if you have a situation where primary healthcare systems are not functional, we need to ask questions. And that there are political issues. There are so many non-functional local governments in the first place. If local governments are not functional, then the likelihood of primary health systems functioning is really very, very low. So knowledge is key. Knowledge for the family, knowledge for health workers, knowledge for political leaders, knowledge for religious leaders. Our country, where our people are deeply religious, which is a good thing. They listen to our religious leaders. So improving knowledge across the board in our communities is really very good.
All right, Dr. Nsofa, a global health equity advocate, thank you so much once again for your time.
Thank you, Doc.